There is a phenomenon in medicine called a paradoxical reaction. It occurs when a drug produces the opposite of its intended effect in a patient. This is not a rare theoretical possibility. It is a documented clinical reality that affects a meaningful number of patients, and it is one of the most underappreciated dangers in pharmacology because it can be nearly impossible to detect without knowing to look for it. When a patient gets worse after starting a medication, the most natural assumption for both the patient and the doctor is that the underlying disease is progressing. The medication may be increased. Additional medications may be added. The possibility that the drug itself is causing the deterioration may never be seriously considered. Benzodiazepines are prescribed for anxiety disorders and are among the most commonly used psychiatric medications in the world. In a subset of patients, they produce paradoxical excitation. Instead of calming anxiety, they intensify it. They can trigger panic attacks. They can cause agitation, hostility, and in some cases, disinhibited behavior. Children and elderly patients appear to be at higher risk for paradoxical benzodiazepine reactions, though they can occur at any age. Laxatives provide another instructive example. Taken occasionally for constipation, they work as intended. But taken regularly over long periods, they can damage the nerves and muscles of the colon, reducing its ability to function independently. The bowel becomes reliant on the laxative to move at all, creating a dependency that is a direct product of the treatment itself. Medication overuse headache is one of the most common neurological conditions seen in headache clinics. It occurs when pain medications, including over-the-counter options like ibuprofen and acetaminophen, are taken too frequently for headaches. The result is a rebound phenomenon where the medication itself generates headaches more frequently and more severely than the original condition. The treatment for medication overuse headache is to stop the pain medication. The withdrawal is intensely painful. Patients have to get worse before they can get better. Antipsychotic medications can in some cases worsen psychotic symptoms, particularly at certain doses or in patients with specific underlying conditions. When a patient on an antipsychotic becomes more psychotic, the clinical instinct is to increase the dose. If the drug is contributing to the problem, increasing the dose makes it worse. The patient who cannot tell you the medication is harming them is given more of the same medication. These paradoxical effects are not listed prominently on most drug labels. They are known in the medical literature. They are not systematically communicated to patients. And they continue to harm people who have no idea the treatment is the problem.